Welcome to Phase 3 of the Total Knee Replacement Rehabilitation Program. In this phase, we'll continue building on the progress made in Phases 1 and 2. This phase focuses on enhancing knee strength, stability, and range of motion as we prepare for more challenging activities. In Phase 3, we continue to focus on improving knee range of motion, with a progression on balance and strength. These activities will help prepare you for more functional tasks and the advanced exercise in Phase 4. In Phase 3, which typically occurs 7 to 8 weeks post-surgery, we have three main goals. First, we aim for an improved range of motion, targeting flexion beyond 115 degrees and full extension at 0 degrees. Second, we'll focus on building knee strength and enhancing balance, which are essential for everyday movements. Lastly, we'll begin integrating functional tasks to increase your confidence and prepare you for more advanced exercises in Phase 4. Let's go over the exercises for Phase 3, which are designed to enhance knee strength, flexibility, and control. These include leg elevated heel slide, quadriceps, prone TKA, bridges, heel raises, squatting, tandem balance, forward stepping, and bag hangs. Practicing these exercises regularly will help solidify your progress and prepare you for the challenges in Phase 4. For the leg elevated heel slide, use a towel or strap for assistance. Slide your heel towards your body, hold for 10 seconds, then extend your leg. Perform this for 2 minutes, 3 times per day. In Phase 3, use the stair lunge to build knee flexibility and strength. Step onto a low step with your affected leg. Shift your weight forward, bending your front knee, until you feel a light stretch. Keep the back leg straight, and use a handrail or counter for support as needed. Pause briefly, then straighten the front knee to return. Begin with 3 sets of 10 reps, 2 to 3 times a day. As you improve, try using less support or bending your knee deeper. In Phase 3, start with the basic knee extension isometric to build quad strength and stability. Sit in a chair with your knee bent at 90 degrees, place your foot against a wall or loop a towel around the chair leg. Push your foot forward to engage your thigh muscle, holding for 20 to 40 seconds. It's normal to feel some shaking or fatigue in your quad. After holding, relax and repeat for 5 reps. In Phase 3, the bridge exercise is used to strengthen the glutes, hamstrings, and lower back. Lie on your back with knees bent and feet flat. Lift your hips by squeezing your glutes, hold the position for 3 to 5 seconds, then lower slowly. Perform 3 sets of 10 repetitions, 2 to 3 times a day. Focus on controlled movement and engaging the muscles fully with each repetition. For the sit to stand exercise, begin with a cushion on a standard height chair to slightly reduce the depth, making it easier as you build strength. Sit with your feet shoulder width apart, lean forward slightly, and push through your heels to stand up. Slowly lower yourself back down to the chair, keeping control. As your strength improves, progress by removing the cushion to increase the depth. Perform 3 sets of 10 repetitions, 2 to 3 times per day, aiming to minimize hand support as you become stronger. In Phase 3, the step up builds strength and control in the knee and leg muscles. Step up onto a low or medium height step with your affected leg, pushing through your heel to lift yourself. Keep your knee aligned over your foot. Slowly lower yourself back down with control. Perform 3 sets of 10 repetitions, 2 to 3 times per day. To progress, you can increase the height of the step as your strength improves. In Phase 3, the step down from a low step improves knee stability and control. Start by standing on a low step with your affected leg. Slowly lower your opposite foot to the ground, focusing on controlled movement and keeping your knee stable. Use hand support if needed. Perform 3 sets of 10 repetitions, 2 to 3 times a day. To make it more challenging, reduce hand support or try using a higher step. In Phase 3, balance practice on a flat surface helps improve stability and control in your knee and hip. Stand on one leg on a flat, stable surface. Engage your core and keep your hips level. Hold for 10 to 20 seconds, then switch to the other leg. Perform 3 sets on each leg, 2 to 3 times a day. As you progress, try reducing hand support to make the exercise more challenging. Phases 3, continue with bag hangs as done in earlier phases to improve knee extension. Sit with your legs supported on 2 chairs and place a weighted bag, 1 to 10 pounds, over your knee. Let gravity gently straighten your knee, holding for 3 to 5 minutes. Repeat 3 to 5 times per day. Let's quickly review the exercises from this phase: leg elevated heel slide, stair lunge, knee isometric, bridges, squatting, forward step up, forward step down, balance, and bag hangs. These exercises have laid a solid foundation for more advanced movement and stability. Once you feel confident with these exercises and have met your goals, you'll be ready to progress to Phase 4, which will introduce more dynamic and challenging exercises to prepare you for daily activities and full functional movement. This concludes Phase 3 of the rehabilitation program. If you have any questions, please reach out to your therapist or healthcare provider for guidance. Remember to follow your rehab protocol closely and track your progress. Once your knee is strong and stable, and you've received clearance from your healthcare team, you'll be ready to move on to Phase 4. In Phase 4, we'll focus on advanced strength, balance, and functional exercises to prepare you for returning to daily activities with confidence.